Vanakkam. Welcome to this course on classics in neuroscience. In the last few weeks, we looked at neural circuitry and neural systems. In this week, we look at neurology and foundations of brain imaging. In this video, we will look at the background for neurology, that is the foundations of brain imaging. Neurology probably originated in England in 1861, where there was this hospital for relief of epilepsy and paralysis. The hospital was called as National Hospital for Relief and Cure of the Paralyzed and the Epileptic at the Queen Square in London. So, in the United States, there was developments in this field with the work of Wade Mitchell, who reported his observations about injury to the nerve in his article Gunshot Wounds and Other Injuries of the Nerve. Also, William Hammond, who wrote a textbook, a treatise on the diseases of the nervous system, which can be considered as perhaps the first textbook of neurology. In 1884, Hewlings Jackson joined the hospital at Queen Square. He is considered practically as the father of British neurology. Remember, we have discussed the contributions of Hewlings Jackson, especially in diagnosing and treating epilepsy. We have discussed this in the past. For most of 19th century, American medicine remained an unregulated practice. There was no regulation, there was practically very little control. The situation was so dire that they brought in a non-medico, Flexner, to study the situation of healthcare and medicine in the United States and suggest ways to improve it. So, in 1910, Flexner report came out, and that suggested that medical schools in the United States must maintain full-time faculty to teach medicine. This led to the availability of academics who can teach as well as perform research. Also, because these doctors were fully focused on teaching and they did not have to practice as much, as in they did not have to fully depend on patient care. They can spend some time to teach also. Of course, they will practice, they had to practice to keep their practice up, but they were not fully required to focus on practice, but can also focus on research and teaching. So, this led to the development of research based academia in the field of medicine in the United States. Mitchell and Hammond went on to found the American Neurological Association. Of course, in the good old days, there was no clear differentiation between mental diseases and nervous disorders. So, in other words, there was no clarity or differentiation or distinction between, say for example, the psychiatry department and the neurology department. And it turned out that psychiatry as a field started flourishing in the 20th century, but this growth did not cause a concomitant growth in neurology, but rather caused a slowdown of the growth of the field of neurology. After Flexner report, there was a suggestion to have neurology as a specialization and specialists in neurology be trained. But however, it was very difficult for neurologists to make ends meet, to make a living purely out of practice of neurology in the early 1900s. Why? Because what was the treatment? They were able to count the number of symptoms or count the occurrence of symptoms or observe some symptoms and then describe, okay, this is what the patient is having, these are all the symptoms that are found. But practically there was no treatment. Because there was no treatment, very few people actually made a living out of the practice of neurology. In 1930s, there were as few as 100 neurologists in the United States, but this number grew to more than 1,400 in 1950. What changed? Because in 1929 there was the arrival of EEG that was discovered by Hans Berger in 1929 in Germany. So, this led the development of neurology as its own specialization, and was able to provide, this tool was able to provide information to the neurologists about the state of the brain and the health of the brain and the diseases in the brain. Remember that these waves that are measured in EEG essentially represent the summed activity of many neurons. These are field potentials, these are not intracellular recordings. These are not even single unit recordings of the kind that we discussed in the previous weeks. These are rather local field potentials, summed activity of a whole bunch of neurons. But still it was giving crucial insights into the nature of health and disease in the brain. So, until the advent of EEG, practically there was very little for the neurologists to do. After the invention and discovery of EEG, there was so much improvement in diagnosis of health and disease in the brain, especially in the diagnosis and therapy of epilepsy. We will look at all these things in the future videos. In this video, we looked at the historical background of the foundations of brain imaging, essentially started with the invention or discovery of EEG. Thank you for your attention.